Pharmacy Friends brings industry experts to the same table to talk about what's happening in pharmacy today, what's coming, and most importantly, what it means to you. We explore and share pharmacy trends stemming from the evolving healthcare market, where advancements, policy changes, and technical advancements make a difference. One of the goals of AMCP is to achieve improved access to care, and our next study looks closely at the factors that may impact that access. Social determinants of health are the conditions in a person's environment that affect health, function, and quality of life outcomes and risks. These factors contribute to as much as 80% of variation in health outcomes. In this segment, Kyle Thompson, data scientist principal with Prime MRX, talks about how the development of a Medicare member-specific medication non-adherence risk score related to social determinants of health can improve how an individual manages medication and adheres to a primary care treatment. Hit it. Okay.
Cool.
Yeah, not a bad setup, isn't it?
No, yeah, that sounds nice.
I know. Ben was getting a lot of joy out of doing the really close-up microphone.
Oh, yeah.
Well, Kyle, it's good to have you on the podcast. How's AMCP going?
Thanks, Alex. It's going great. Learning a lot. Just trying to take it all in.
That's great. So, social determinants of health is a huge topic with a ton of variables. How did you design this research to get such a focused conclusion?
It takes a few years of work to get to this point. Colleagues have been doing a lot over the past few years. Roughly 2 years ago, I reached out to a few people and informally started a health equity connection group across Prime and now Magellan combined company. And so it's taken a lot to get to this point and a lot of research. But then we asked, okay, now we have a focused product, a focused ask for this Medicare population. And we said, what's available? What can we do quickly? And how can we explain it transparently to clients without going into too many details and trying to take on the whole world of social determinants of health.
So what are some of the best sources of data for addressing health equity and social determinants of health?
Yeah, so I was on the PQA Health Equity Technical Expert Panel, and it included a number of people that had expertise in this area, and a lot of organizations have this expertise. What they kind of did is rank variables, and the top two that show up are always age and sex. But then for Medicare, you got your three variables that are low income subsidy, dual eligibility with Medicaid, and then disability, largely determined by the Medicare enrollment. So if someone ages into Medicare or enrolls in Medicare for disability reasons.
So how do we and other healthcare organizations use this data, and what are some of the incentives to improving health equity?
Yeah, previously, prior to 2024, there were very few monetary incentives to improving health equity with the Medicare Health Equity Framework for 2022 to 2032 and the Health Equity Index. Starting this year with data collection in 2024, there are now monetary incentives to make this happen. And so the Health Equity Index is those three Medicare variables only to start with. But there are a lot of organizations using other variables, and for the future, we incorporated some of those variables, seeing as this product could evolve and this research could evolve down the line.
So as we noted previously, improved access to care is a core principle of Prime MRX. So what are some of the reactions you've heard from people at the show in response to the research?
Well, I know that there's a talk this afternoon, so hopefully people can listen to that with Ben Urich, Lisa Lurer, and Sujith Ramachandran. So I hope to get some feedback there. I haven't heard a lot about social determinants of health specifically to our research, but the talks typically are crowded on the related lectures, and everyone kind of has their own spin and uses their own data. Some are focused on the platforms, some are focused on the clinical outreach. We think we developed something that's very simple for pharmacies to use to incentivize outreach for adherence to members and not think too much about it after that, because we've done the hard work.
That's great. So we're asking trivia questions.
Okay.
So this is going to be a surprise for you, but it's about New Orleans. It's about our host city. And just wanted to see if we can test your knowledge. So here's your question. This jazz legend, born in New Orleans, is nicknamed Satchmo. What is his real name?
I don't know for sure. I'm gonna guess because I think the airport is named Louis Armstrong Airport. That might be.
You got it.
Yeah?
Nicely done.
Okay.
Nicely done, and nice tie into the airport name. That's good.
Yeah.
Well, thank you very much for your time. We really, really enjoyed the conversation, Kyle. Thank you.
Thanks, Alex.